Okay, on this video, we're doing a video on catheter care. So, as always, introduce yourself to your patient, tell them what you're going to do. I have a male patient that has a Foley catheter in. I'm going to wash my hands, don on gloves, tell them, hey, we just got to clean your peritoneal area. So, I always bring like a absorbent pad and a washcloth, just pretty much just with soap, just to mainly just clean that tubing around the penis so the patient won't get no infection. All right, so got my patient in supine position, like I said, he's a male. Wash my hands, I don on some gloves. Okay, so from here, I've got my washcloths, my padding. I'm gonna have to put this underneath the patient. I put the absorbent padding underneath the patient, and I'm gonna since they got that little stat lock on their thigh, or if it's tape, whatever's securing the tubing to the patient's thigh, let's go ahead and remove that. Okay, so from here, get my washcloth. I guess for non-dominant hand, just grab it. If that male has foreskin, just retract it. And then with your washcloth, just clean circular motions from the meatus down. We're just going to circular motion, cleaning the penis, working your way downwards. And from there, instead of your non-dominant hand, just grab you just kind of from the tubing, from where it meets the meatus and down, you're gonna just same thing with your washcloth, just clean down, because this is pretty much going straight into their bladder. So if you don't clean this site, it's gonna risk for same thing, infection, UTI. So you always gotta make sure you clean this. Like I said, if you can pull on it, just make sure it's still secure. But the main thing is always grabbing it from the meatus and kind of clean it from that tip and down, going in downward motion, not going in downward, so we can remove much of that as we can. And from there, so we clean all that. We can if they're uncircumcised, you can just retract that foreskin, and then of course remove that stat lock. So we have to put a new one back on the patient. So place a new one back on, dry the patient up, and of course from there, throw away all your supplies, all the padding, remove all that, get the patient back comfortable, safeties up and all that. Remove your gloves, perform hand hygiene, and then make sure you document what you did. And of course, if you see any type of pus or anything like the penis or genital areas getting infected, make sure you notify the doctor, because sometimes, like I said, sometimes they don't clean it, so they risk the patient for getting infection. Once you do all that, document your findings and report anything you see abnormal to your healthcare provider. And that's it for catheter care.